Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. That is one of the first places that you see problems in the body. And I think we even talked about how, urinary tract infection can cause a lot of confusion in an elderly person. So the brain is fragile. It shows the effects of physical problems early, and in an elderly brain, that's even worse.
Indeed, I've seen patients who have had multiple surgeries. As we age, we have more difficulties. They may have had open heart surgery. They may have had other kinds of surgeries, as we said, joint replacements, all kinds of things. And those multiple surgeries can cause the fragile brain to have some impairments.
When you think about it, every time you have surgery, although oxygenation is monitored and breathing is monitored, with open heart surgery, for example, they have to completely divert all of the blood in the body around the heart through the pump and back into the body so they can work on the heart. So there's a lot that goes on, and any of these small permutations, these small changes, can be enough to throw a fragile elderly brain into some symptoms of dementia.
Now, this is not to say that if you ever have a surgery, you're going to come out on the other end of the surgery as if you're some late stage Alzheimer's person who can't even dress themselves. It's not that a surgery will cause this severe dementia.
And it's not to say that the medical care that somebody receives in surgery, if they have memory problems afterwards, that medical care was bad. We are doing more and more complex surgeries that we would not have conceived of doing 30 years ago on people who we would never have performed surgery on 30 years ago. Open heart surgery used to be a month in the hospital of recovery, and now it's 2 or 3 days on people who are older and older and older. So the edges of the envelope are being pushed. Besides the changes in oxygenation and blood supply that can occur during surgery is the medication, the anesthesia. In cases such as a hip fracture, lots of chemicals are released from the body just from the injury itself. We call those cytokines and other, they have names for them, but they're inflammatory things that can actually have effects on the brains when they're released in this big rush in the body from a massive tissue damage that happens with a fracture of a big bone like a hip.
Well, and it's one thing to think about if you have an older loved one who's going in for surgery, that you're able to help the hospital staff monitor how they're doing as they're coming out of the surgery. And people will look, the surgery will have healed to the point where they can be discharged, but it's really up to the family to make sure once they get home that things go okay, that they're not just, well, you're fine, your stitches will come out next week, go ahead on home. It's up to the family to really try and figure out how they're doing with their daily routines once they get home after the surgery.
Especially if, since after surgery, medications may have been changed.
Oh, right.
And even if we're not talking about pain medications, if the other regular medications have been changed, you can have a very different functioning on one set of medications versus another one, even if there may be fewer. And then you get the added complication of pain medications thrown into that mix coming home. Pain medications, that's going to affect somebody's cognition and memory.
And your physician, your loved one's physician, needs to know what changes you're noticing, because it is that knowledge that allows them to change the medications
Right.
or to take appropriate action.
Go back
If-
and figure out what's going
yeah,
on.
if you don't say anything to somebody, nobody will know about it. So it's very important to maintain the lines of communication with the medical personnel.
With an elderly person getting surgery, the things that I would think about are, is it an elective surgery? Does it have to be done? What are the risks and benefits? It's anecdotally out there. It has been reported. People are seeing that after surgery, some people have more cognitive problems. Is the risk of that worth having the surgery? And you have to weigh that. The second thing is, be involved as a family. Keep those lines of communication open with the
Absolutely.
physician, and keep a close eye on your loved one. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.